Welcome to Suzanne's Real Life Real Estate. I'm Suzanne Prezio, and as you know, this podcast is about people in our community. It's about businesses and business providers that have a service that you may be interested in. It's not about buying and selling real estate, which of course I can help you do, but it's more about introducing you to people that are in the area who may offer a service for a need that you have. And today I am very excited to have my dear friend and former buyer, Dr. Christa Corbett from Upstate Veterinary Specialties. Hi, Christa.
Hi, Suzanne.
And I understand you're calling in from your home and not your cabin in the woods. So
true. This is where Suzanne and I met.
Yes. Actually, Christa found me on the internet. You were moving here from Ohio. I'll get to that when I do your biography here, but you found me on the internet, and we spent 3 fabulous days together with you and your husband Max, and we just clicked. We became friends. Now you're my March Madness buddy, and we're each other's sounding boards, and it really was a great find for both of us, I think. So
Indeed. It's been 8 years at this point, and we're still very close. And Suzanne helped me indirectly find my Adirondack cabin, and she's wonderful.
Well, thank you.
Very sweet, very helpful.
Not a paid promotion either. It's
Although
probably we'll have some drinks after to talk about it. So I just want to do a little bio on you, because when I was researching you, I was pretty fascinated because you're very modest. You are, my friend, the doctor, but you're very modest, and you're a smart cookie, Christa. Born and raised in Rochester, and then you obtained a degree in biology from the University of Pittsburgh.
Yes.
You received your doctorate of veterinary medicine from the Atlantic Veterinary College in Prince Edward Island, Canada.
True.
And then you returned home to Rochester and did a small animal internship. That's where the ophthalmology really kind of started to pique your interest.
Yes, that was actually in Long Island.
Okay, in Long Island. Okay. Mm-hmm. And you stayed an extra year there to do your specialty internship. And yes. From there, that's when you headed out to Ohio?
Yes. And, different world in the Midwest.
And did your residency. And you are a board certified and a diplomat of the American College of Veterinary Ophthalmologists.
Yes, ma'am.
So I read special interest in mammalian exotic pets, which you said there's a translation for that.
I don't like reptiles. I actually have a obsession of ferrets. I like rabbits, I like guinea pigs, but there's just something about ferrets.
Okay, all right. And eyelid reconstructive surgeries. Says you've participated in research for monitoring of glaucoma patients, surgical treatment of glaucoma, and novel eyelid reconstructive procedures. So you have been here since 2013.
Yes.
Now the facility that you work at, I mean, I'm kind of the real estate agent for the doctors, because I mean, you've introduced me to oncologists and cardiologists, and even you had a social worker on staff there, because our pets are babies. You know, I had my cat's teeth cleaned yesterday, and it was yeah, I actually missed a phone
experience call for you.
Yeah, they kept saying that her, last 3 years, and I finally brought her in, and it was, traumatizing.
Yeah, it's hard. We understand that aspect too.
Well, I know.
As well as the vets.
Yeah. Well, yes, because you're a pet owner, and I understand you're going to be getting a new pet.
I'm going to be a new chocolate lab mommy in 2 weeks. So she is adorable. Her name is Alice, and she's going to be 8 weeks in 2 weeks.
That's exciting. It's like having a newborn.
Yes. I have been shopping for her because we've only had rescues before. I've never had a puppy. So I've been learning and webinars, and it's even though I'm a vet, it doesn't mean I know how to raise a puppy. So it's a excellent experience, and I'm so excited. So I just went and visited her yesterday.
Oh, really? Really? How many were in her litter?
8.
Okay. All right. Great. So tell me about what you do.
Well, so I am trained to look at the eyes of any animal other than a human, any species other than a human, I should say. So in my residency in Ohio, we had quite a hefty large animal caseload, as well as your typical dogs and cats and some exotics. Here, I really only focus on the small animals. I can go see a horse or a farm animal. It's just there's so much need in the small animal aspect. I just don't have a lot of time to do the others. Um, but it's basically a referral process. So if your animal has an issue with the eyes, so if you think they can't see well, if they're squinting or you're seeing a lot of discharge or something just doesn't look right, typically your first step would be to take them to your veterinarian. And your veterinarian is trained in a lot of the basic aspects of ophthalmology, but sometimes things aren't so simple, or they may not have the equipment necessary to do a complete ophthalmic exam, and that's where they would refer to a practice like Upstate Veterinary Specialties. There's 2 of us there. Myself and Dr. Montgomery are both the ophthalmologists, so we see cases on a referral basis.
I was stunned by how busy you are.
Yes, we are. So we get business from all over upstate New York, including Vermont, New Hampshire, Massachusetts, Connecticut. The closest ones to us would be Ithaca and Westchester County. So we pretty much have the upstate radius all to ourselves. There's ophthalmologists in Buffalo as well, but so we get people from all over those states.
So your schedule, Christa, is it consistent in that, Monday is consult, Tuesday is surgery, Friday's paperwork?
We try to make it that way.
Okay. All right. But if you need to, you're an emergency clinic.
Yes. Yes. So if your animal had an issue, and of course it never happens to go on the 9 to 5, you can bring your pet into our hospital through the emergency service. If you can get into your vet, of course you would do that as the first line. But if it's 10 p.m. on a weeknight or on a weekend, you can bring them in through the emergency service. And our emergency doctors are very well trained, probably even a little bit more so than a lot of general practitioners, because they work on a lot of cases hand in hand with us. They have the ability to get in touch with myself and or Dr. Montgomery and present the case, usually digitally, in terms of a verbal case history, some of their objective tests they may have done. And then of course there's always the digital age of photos and videos now. And if it's a medical case, we can offer advice on how they should treat it for the time being. If it's an emergency that requires our physical care, then we can come in and do emergency surgeries on the weekends or evenings.
Typically, how many days a week do you operate?
Typically 4. Because of the pandemic, everything is different.
Well, pre-pandemic, and we're going to get to that too. Thank you for reminding me. I forgot about the pandemic. What? Pre-pandemic, how many days a week were you in surgery?
Usually 1. I did have a half day of usually procedures, which typically weren't surgeries, but they could be. So 1 to 1.5 days of surgery.
How many would you say you do in a day?
An ideal week would be about 3 to 4 a day. Sometimes we've gone upwards of 5 or 6. We have such an ebb and flow in surgeries. There's times when I'm booking out a month or 6 weeks for a surgery, and there's times where I can get you in the next week. And of course, the urgency also helps to dictate that.
Sure, if it's trauma or something yeah, I get that. So, since you brought it up, how has the pandemic changed how well, I shouldn't use the word operate because I don't mean that. How, your daily running of the hospital. You're not able to be face to face with
Mm-mm.
the fur parents anymore.
Exactly.
So
And that's really tough. I think, there's always this thought that we love it because we don't have to see clients anymore, and just dispel that rumor needs to be dispelled. We don't like it as much as you guys don't like it because we know the stress that's involved on your end, physically handing your pet to a likely stranger. We have a lot of cases that we've seen for years and years, and they know us, but a lot of our clients in the past 10 months are new. And so they don't know me. They don't know the technicians that are coming out to get their pet. So it's stressful on the parents. It's stressful on the pet. But I promise we would never do anything with them different than what we would with our pets or in a typical exam situation. So whether you're sitting in the exam room or not, your pet is getting the exact same care as if you were watching it happen. So that's, I would say, the biggest problem. We've tried FaceTime, we've tried Zoom, we've tried digital platforms, and it's not easy in that sense because people are in their cars and they can't really get it to connect, or you have connection issues. It's kind of a standard phone call, and that's difficult if you've never met the provider.
and I know that's weighed on you because you and I had talked about it, and you have said how you really do miss the one-on-one with the patient, and even for that patient to be able to give you a hug and thank you for doing a great job, or even having to console a patient if you need to. But
Yes.
so I know you're missing that human uh, interaction.
Yes,
And that's what makes you such a good doctor.
On one hand, though, I will say the only benefit to curbside is when you get that adorable but nervous, usually dogs, cats too, but usually dogs. When I'm done with my exam and mom's in the room, they run right back to mom. Now I get to play, I get to wrestle, I get to cuddle, I get to love them because I'm the only one available. And yes, we do bring them back out to parents, but that is one thing I've noticed with dogs is I finally get a little bit more love from them.
Okay.
Coerced, I guess.
You just made lemonade out of lemons. That's great. So, I've looked at some of the reasons people may bring their pet in, that the eye condition is not responding to recommended therapy. Their vision seems to be deteriorating despite treatments. An ulcer that's not responding. Diabetes.
Yes.
You see a lot of that in pets?
I sure do. I would say diabetes is incredibly common, but there's so many diabetic consequences. Believe it or not, ophthalmology is probably the number 1 or 2 service in the hospital that sees diabetic animals. We see more than a lot of our other services combined. So they do have a lot of consequences, and we just know what to look out for and what to monitor for and try to make sure they keep their vision and their comfort. It's a big thing.
What's new in technology?
In terms of pandemic and such?
The procedures. I mean, I'm sure do you have to go to continuing ed?
Yes, we have to get 15 hours a year of continuing ed for New York State.
Okay.
And so that used to be in-person conferences, and every year it was the American Veterinary Ophthalmology Conference we would go to, and that was wonderful because it's all the colleagues that have done the exact same training as me. Friends, old friends, new friends, and just collaborating. That is now digital for who knows how long, but it's extremely beneficial in the sense that we sit down and watch lectures and there's wet labs and hands-on, but we also talk to vendors about new products and new technology, new surgical instruments to accomplish the same goal. And that's all that's there, are veterinary ophthalmologists. So they are reaching their target in terms of showing us what is available and what's new.
And that's what I'm wondering, if there's new laser technologies or interesting. And I found these stats I love researching these things. I went on the website for the American College of Veterinary Ophthalmologists, and you may have, like I could have turned this into a little quiz here, but
Oh, great.
93% of people would risk their life for their pet. Okay, they surveyed, let's see, I have down here who they surveyed. This is based upon a survey of 1,238 pet owners in the United States and Canada who use AAHA accredited veterinary hospitals. Okay, so out of these 1,238 folks, 93% would risk their life for their pet.
I'm one of those.
Yeah, I always tell my kids, I love the cats more than I love them. And my kids know that. 53% spend more on their pets now than 3 years ago.
Wow.
67% travel with their pets.
That's great. Especially
36% say their pets enjoy watching television, which is what makes your job even more important because they have to be able to see.
Absolutely.
64% expect a pet to come to their rescue if they were in distress.
Okay, that one's laughable.
Yeah. Well, you've met my Lucy. I could just see her,
She's the cause of the distress.
30% say their pet is emotionally sensitive.
I would agree.
And 58% visit their vets more than their own doctors.
Absolutely. I didn't know that was true, but I'm not surprised.
I found this yesterday and I said, I think Christa's going to love this. So your office is in Latham.
Yes.
And the other specialties that are there, as I said, we have cardiology, oncology. What other doctors?
We have neurology, internal medicine, emergency, surgery, surgeons, and radiology. That's what we have at UVS. There's others that we would like to get in the building, like dermatology and dentistry. We have ads out, so if anyone knows anyone. But those are the most common clinical specialties.
What's the most unusual animal you ever worked on?
I have a lot, actually, because I was very blessed to be a consultant for the Columbus Zoo when I worked in Columbus, Ohio. So my favorite exotic patient was Edward the moose. He was so sweet, didn't even need sedation for exams or
really?
medications. Yeah, he was so sweet. And let's see, I also saw kiwis, penguins, tigers.
What was the first one you said?
A kiwi.
Kiwi? It's a fruit, isn't it?
That as well, yes.
I've never heard of a kiwi.
It's a type of bird. Typically, if I remember correctly, in New Zealand. I hope I'm not saying that wrong. Let's fact check.
Okay, all right.
Don't go with me on that. But yeah, it's a little bird, and oh man, do they have a lot of eye issues. At least this group did.
Okay.
Oh, a monitor lizard. I worked on one of those. So
Really?
not all reptiles. If reptiles have legs, they're okay with me.
Okay. Good to know. I'll remember that. Next time I come over, if I'm going to bring a reptile, I'll make sure it has legs.
Good.
So most unusual, I don't know, injury, situation, case?
I have them all. I've treated patients that have had super glue administered to their eye instead of an eye ointment, because sadly that looks so similar and it's happened numerous times.
Oh my gosh. Okay.
Believe it or not, they do okay. Another, I don't want to say common, but twice in my career, I have had a Pyrex dish explode and go into an eye. Who knew Pyrex explodes, but when it explodes, it goes far and fast.
Yes.
And then one thing, can I just do a giant public service announcement?
Please.
If you get a puppy, do not let them say hi to your cat. I can't even tell you how many cat claws to brand new puppy eyes I see. That's so common, especially around the holidays, it seems.
What's the best way to introduce them?
Very slowly, and introduce with a leash so that the cat has the ability to get away and the puppy can't corner them under a bed or behind a couch or something. And most importantly, if you trim those cat's nails a couple days before the puppy comes into the environment, we can handle a blunt wound a lot better than a sharp wound.
Okay.
So,
Okay.
yeah.
I was going to ask you if there was anything that pet owners could do to help their pets maintain healthy eye function. Is a lot of it diet? Is a lot of it environment? I'm sure smoking around your animal is not preferable.
Not recommended.
You know, and it's kind of like when we go to our relocation refreshers and they tell us, don't smoke in the car. Yeah, well, I was going to crack a beer and, light up a smoke while I have out of towners in the car,
No, not ideal.
Thanks for telling me, but I didn't really need you to tell me that. So I would think that the quality of food, right?
Just being healthy in general and having a healthy diet is excellent. And that goes for a lot of different things with pets, of course. I think one of the biggest things that I would recommend if you're looking to get a pet is research it. There are certain breeds that we see, every day, quite a lot of them. Pugs, Boston Terriers, Shih Tzus are so incredibly common to have eye problems. And breeders can actually do certifying examinations ahead of time before you acquire these dogs to say, do they have any genetic or birth defects? And that doesn't stop everything, but if you know you get a healthy pet into your household and then you watch closely for some of the things that those breeds are common to have, then you'll be better off.
Okay, that's good to know. That's good. Yeah, so it's almost genetic.
Yes, yes.
Okay. So backing up, you had a blank canvas in front of you. You could have chosen any specialty. What brought you down this path?
Well, when I was in vet school, I thought I wanted to do emergency or exotics. In fact, I did. So in vet school, you can sometimes pick rotations where if it's not in the vet school, you can actually travel somewhere and do a rotation with specialists in these areas. And I did, I think, 2 exotics rotations, thinking that was going to be my area. And even though I still love exotics, as you mentioned, I just realized it wasn't for me. So my first year out of vet school, one of the best things a vet can do, you don't have to, but one of the best things you can do is a general internship. And that is where you go to a practice with lots of specialists and you are hired on for a year. Yes, some might call it slave labor, and that's true. You get paid a little, but you sign on for a year and you experience all of these different specialties. So you spend 1 to 3 weeks at a time with each specialist, and you basically work alongside them. So I did that in Long Island at Long Island Veterinary Specialties, and I worked with a fantastic mentor, Dr. John Sapienza, and he just blew me away. The fact, I think the biggest thing with eyes is you can be an expert in an organ. If you are an internal medicine specialist or a surgeon, there's just a lot more to know and a lot more to focus on. But as an ophthalmologist, you can know every single thing there is about eyeballs, everything. And you can do the medicine on them and you can do the surgery on them. And you also know how they correlate with the neurologic system and the cardiovascular system. So you have knowledge of general medicine, but you can focus so specifically on one organ and be an expert. Being that I'm a little bit of a control freak, as Suzanne well knows, it was perfect for me. I had to know everything about what I was going to do. And that's when I realized that was my calling.
You're thorough. It's not being a control freak. A control freak is impossible to be around. You're thorough. You like to know what's next.
True.
That's okay. There's nothing wrong with that. So your education, I mean, not easy. So you take me through. Was it 4 years of undergrad and then what? How many years?
4 years of undergrad, and I chose a biology degree. Technically, you can have any degree as long as you have certain core courses. You also then have to get a lot of hands-on experience with veterinarians. So prior to applying to vet school, you have to have multiple different experiences. I was very lucky to be hired on by a local vet clinic when I was 17 or 18, and I worked there every weekend, holiday, and summer through undergrad. And so I did 4 years of undergrad in biology, and then I graduated with that, and I went on to 4 years of vet school. From there, you can actually go out and be a vet. But again, like I said, an internship is a good idea. So I did 1 year of a rotating internship in Long Island. And then because I loved ophthalmology so much, I did 1 year of an ophthalmology only internship. And that's when you apply for residencies, which when I was applying, there were only 17 positions in North America, US and Canada. And thankfully, I got one of them at the Ohio State University, and that was for 4 years.
That is impressive. That's because you're a sharp cookie. Yeah, that's impressive. Wow.
4 years? How long was I at Ohio State? 3 years. I'm sorry, 3 years of residency. I don't know how I forgot that.
17 positions, and you got one of them. That's amazing. That's great.
Yeah. So I actually didn't. What did that come out to be? I think it was 12 years post high school before I had a real job.
Wow, it's a lot. It's a lot of school, and you're married to a teacher.
Yes. He likes to say that he's still a junior high. He's still an 8th grader.
That's our max. So,
yeah.
Now, other than cats and super glue, what are other helpful hints that you can give homeowners about hazards they may not recognize around their house? The things that come across your threshold when you think, oh, well, that's a new one.
Pyrex.
Pyrex. Christmas trees? Do you see a lot of injuries from Christmas trees?
I don't. Christmas trees, believe it or not, they're actually pretty gentle. Even though they look sharp, animals tend not to get too traumatized on them.
I think Lucy has knocked my tree over 3 times. Yeah, she weighs 7 pounds, and then she's definitely she's winning the Christmas tree battle.
That sounds about right.
And I see that I watch her. I see her looking at it, and it's like Charlie Brown and Lucy with that football. Until I see it, I'm like, yep, you got it again. Okay. So. Yes.
I would say most of our hazards come from outside. I don't see a lot of indoor household pet eye injuries. Outdoors, one of the biggest things we'll see is actually plant foreign bodies in the surface of the eye. And that's really not much that you can prevent. It's actually usually the seed pod. So if you have maybe in the end of the life cycle of the plant, if there's seed pods and your pet really loves to just go nose first into that area, maybe trim them or just watch closely. And if you see them squinting after they've been outside, see your vet.
Okay. All right. Well, Christa, this has been very informative. I so appreciate you coming on to do this. And before I let you go, dead or alive, if you could have dinner with anyone, who would it be?
Oh, this one's tough. Let me see. I mean, currently I'd say Kamala Harris. If you asked me a year ago, I probably wouldn't have known to say that, but currently that's what I'm going to say.
Okay. All right. Well, thank you for being here. Please tell Max I said hello.
I will tell the kiddos I said hi, and of course the cats.
Yes. All right. All right. Thanks, Christa.
Thank
Dr.
you.
Christa Corbett, from Upstate Veterinary Specialties in Latham. Thank you.